My name is Chasity Vermette. I'm a registered nurse. I'm an HIV clinician in Prince Albert, Saskatchewan, working for the Saskatchewan Health Authority.
How has COVID-19 changed your nursing practice or setting?
COVID-19 has changed our work setting almost completely. Everything from how clients are able to, access care right from walking into the clinic to how they are receiving care. And so we are trying to, maintain an open door walk-in policy, as many of our clients who access our services don't have phones and don't have homes. So it became impossible to switch to what was recommended. We had to very quickly be able to figure out how clients can still walk in through our door and obtain services, with recognizing that our clients aren't going to be able to follow the typical standard for accessing COVID-19 testing. The higher ups outside of my range have, advocated and implemented a testing site right in our clinic. And so they collaborated with, other departments within our health authority, and even so far as other departments out in the community, to arrange, so what would testing in our center look like? And so what we've done is we've created a space to accommodate, the clients who won't be able to get transportation to a testing site, or, make it there at a certain time, or, have the capacity to even, keep an appointment in a few days when you don't know what life even looks like in the next 24 hours. So once we do the testing, the client did present for a reason. So then we will continue on by providing their care. So once we get the COVID test done, then we can finish what they kind of came in for originally. And then as far as my nursing practice, COVID-19 just posed another barrier to the clients that we serve. So their care didn't revolve around COVID, or it didn't change because of COVID. They present with many crises, often, during an interaction. We're dealing with many different things at once. So we're dealing with housing, addiction, and then on top of it, trying to figure out how we're going to provide them with HIV care and get them engaged in care as well. And all of this, occurs in a safe space. And so when COVID came around, it was kind of like nobody had a safe space anymore in reality, because clients' needs didn't disappear, or they didn't minimize because of COVID. Another way that my nursing practice did change is we work with a stigmatized population. And so, you already try and, like I said before, maintain that safe space. And so COVID-19 brought another stigma, where everyone's being screened. So if you have a cough or even a sore throat, it's like people were labeling you to have COVID, and we're like, kind of stepping back, and it made people feel kind of alienated. And this is something that the clients that we work with are already going through. And so it was trying to be able to find that balance to not add more stigma to, a population that already face it and endure it every day. So I think it goes back to just, again, rapport building, creating a safe space, and then as a team, just trying to figure out how we're going to continue to provide care in those contexts.
Tell us about one positive experience you have had in your practice during this pandemic.
Watching our interdisciplinary team kind of come together and come up with very creative ways to deliver care to our population, that can't be offered just through a phone appointment, that can't just be offered through walking in and just seeing your physician. Management was great, and they got their hands on a larger vehicle, so like a 15-passenger van, took some seats out and created it so that you could maintain the social distancing, and so that the outreach staff could still reach out to clients and actually get out in the community and still check in with them and ensure things are going okay. Another thing too is within the interdisciplinary team, it might be an addictions counselor who's coming and saying, I went and seen this client out in the community and they had all these needs and they could list off 4 things. And our whole team, without seeing that client, would jump in and figure out how we're going to support this client at that time with the resources we have. So a positive experience has been definitely seeing the passion in our team come out and everybody wanting to jump in and get creative in how we're going to provide the same quality of care to clients who, have been restricted with their community resources.
What is your best advice or key messages for nurses working in the community?
So my key message that I would like to share with nurses working in the community is to continue the advocacy work that we do. In a time where, phone calls and social distancing and maintaining your distance and staying home is kind of the key messages that we are getting. Continue to advocate for community supports and for the community to continue to provide and engage in client care. Some things that we've come across is, finding housing. Well, a lot of places are terrified to house people right now, like it's a scary time wondering if you're moving somebody who's COVID-19 positive into your space and how it's going to affect everyone. So, things like housing are limited, food security is limited, less and less drop-in centers are open. So, a place to even wash your hands, that's another huge message that's being sent out, is hand washing and not having access to that. So continue advocating for clients that their basic needs can still be met, and, get on the phone. And if it's with housing, try and provide, some rapport with the housing authority, and maybe your nursing assessment and how, this client hasn't displayed symptoms, or, you've been working with them for X amount of months, and, step up and kind of, try and be a voice for them. A lot of clients are feeling, this is, like I said, it's another barrier. And so it's just another hurdle for us nurses working in the community to try and help them get over and, use our voices to help get people the care that they still deserve and get those basic needs met.